Hello and welcome back to another episode of Let's Learn PT. Today we're going to be discussing a concept of shoulder impingement. That is a diagnosis that I encounter frequently in clinical care where I have patients that have inadequate education about what is actually going on with their shoulder and the associated rotator cuff tendons of the shoulder. So like I said, we'll talk a little bit about shoulder impingement, dive into some anatomy of the shoulder, different activities and postural awareness, things that can lead to shoulder impingement and the progression of shoulder impingement long term. And then finally, we'll just talk about a little bit of activity modification and different things going on with the shoulder that can help long term for people diagnosed with shoulder impingement. So first, what is shoulder impingement? We'll use this kind of poorly drawn anatomy picture by me. Right here is your shoulder blade, and here is the actual bone of your shoulder, your humerus. So you have four rotator cuff tendons: your supraspinatus, your infraspinatus, your teres minor, and your subscapularis. Primarily what we're going to be focusing on today is supraspinatus. And supraspinatus is one of those four rotator cuff tendons that runs from just superior to the spina scapula of your shoulder, and it runs along the shoulder and below what's called your acromion. Your acromion is right here on this illustration. It's just kind of the roof of your shoulder. It's part of your shoulder blade, but essentially it goes over the humeral head, because my humeral head is right here, the head of my actual bone in my shoulder, and then my acromion is right here. And you can find the acromion just tracing that collarbone out, going past the AC joint, and then there's my acromion right there. But like I said, that supraspinatus runs from that shoulder blade down under that acromion and onto that humeral head. And it plays a role in kind of stabilizing the shoulder and preventing it from translating upward while we're kind of performing overhead elevation. So if that supraspinatus isn't firing correctly, or it has some inflammation or tendonitis associated with it, we can run into some difficulties and eventually get to the point where we're experiencing some pain and some shoulder impingement-like symptoms. So essentially that tendon is just running underneath that acromion and above that humeral head, and shoulder impingement is just when that humeral head isn't secured well and starts translating superiorly and closing that space and kind of impinging upon compressing those rotator cuff tendons. So essentially, we broke down what is shoulder impingement. It's just a closing of that subacromial space due to posture or different deficiencies in the rotator cuff that can cause impingement or compression of that rotator cuff tendon. So let's dive into some activities, things we do, and the relationship with our posture and our shoulders' anatomical alignment, and how that can affect long-term our rotator cuff tendons and our potential for developing or progressing shoulder impingement. So the first one, our first activity that's associated with shoulder impingement, is overhead activities. So if I work at Amazon and every day I lift packages from waist height to up overhead 300 times a day, 10 hours a day for a couple of years, eventually if my rotator cuff isn't firing the right way and I'm not kind of obeying the right body mechanics, that space can close down, that humerus can translate superiorly, and I can kind of close down that space, because right here that humerus is going up, whereas that acromion is stationary, and we can get some impingement on those rotator cuff tendons, as well as just overall posture and postural awareness. If we're in what I like to call the infamous old lady posture, where we have forward shoulders, forward head, that subacromial space is just naturally more closed down upon those rotator cuff tendons when we're in that position. So those are two different things where we can modify A, our posture, and B, the things we have to do, whether it be taking a little break or modifying activities. If we're a pitcher, maybe taking less reps in terms of a game, instead of 120 going down to 50 for a while until our symptoms kind of calm down. And then finally, so if we do not adjust our activity level at all, we continue to do the same things, our postural deficits have no changes, we can end up with some tendon inflammation and some tendon breakdown and chronic changes in the makeup of those tendons that can lead to the long-standing pain in our rotator cuff, potential rotator cuff tears, and then long-term impacts on our health and shoulder function. So essentially what we can do to change this, like I mentioned, is activity modification in terms of overhead activities, and B, different postural strengthening exercises for our shoulder blade musculature and our rotator cuffs tendons. And also, if we were to want to diagnose this as a physical therapist or as a healthcare professional, a lot of what we look at is a painful arc of motion from about 60 degrees shoulder abduction to 120 degrees shoulder abduction, and seeing if they have some of that pinching feeling in their shoulder that would be that kind of humerus and acromion coming together and pinching those rotator cuff tendons. So that's a little breakdown of shoulder impingement. Thank you guys for watching. Subscribe, follow us on Instagram at lets_learn_PT, and continue to watch our content if you enjoy it. Thank you guys so much. Appreciate it.